Good morning. So my name is Andy Miller. I am the Public Health Officer of Butte County. And the responsibilities of public health in disasters are many. Personally, I serve as the MOOC, which is the Medical Health Operational Coordinator, which means those ambulance strike teams that Dr. Backer was talking about. It's my job to order those and to try to direct them to the sites for evacuation. And public health is responsible under ESF 8 for medical care of those that are sheltered. So those are the things that I do most of the time, and if I do my assigned role correctly, I won't be talking about any of those. What I am going to talk about, and makes me a little bit of an oddity on this great panel, is that I'm not really going to talk about the underserved population or those that have specific cultural beliefs with fire. I'm going to talk about the surrounding communities, the communities around a disaster, and how they might be affected. And I will touch upon a number of the things that we've already heard this morning. So what you see when I'm talking about surrounding communities, I needed to start with this slide. This is a slide from the NASA Landsat 8 satellite at about 10:45 in the morning on November 8th. The fire broke out at about 6:30. Up near where it says active fire is where it broke out. In about 4 hours, if you use the legend, it had moved about 20 kilometers. By the end of the day, it would jump Highway 99. And you'll see in the next slide, there's a little town of Durham where I live that was evacuated as well. So in that day, it moved that far. So Paradise, you can see there's a town of Magalia, which is just above and to the right of Paradise. The town of Concow is also, you'll see in the next slide, pretty much all of those towns were destroyed. Paradise, 90% destroyed. And then you see Chico, and most of my comments will be about what Chico has experienced in the last few months. This slide shows a couple of days later a larger burn scar area, but since it isn't an actual picture of the fire, you can see Concow, Magalia, and Paradise. Oroville, you can see Lake Oroville in the bottom right. The town of Oroville is just below that. So the population of Paradise was about 27,000. Magalia was 11,000. The town of Chico is about 93,000 people, and that's all kind of background for the comments I'll make. What I'm going to do now is talk about the impacts on those surrounding communities, both immediate, short-term, and then some speculative long-term stuff. We're still in the short-term, I would suggest. It's about 7 months from that fire. Just yesterday, 2 of the 85 people that lost their lives were positively identified. We have not completed that process. In the, I think it's the San Jose Mercury Register this morning, it talks about 56% of the calls that went out to warn people did not make it to those phones. So we're still learning as we go along. So immediate impacts of the evacuation, again, on the surrounding communities. If you live somewhere near a disaster, very quickly, your law enforcement, your fire, and your ambulances will quickly be pulled out of your area and will be sent here. So at 8:07, I got a call requesting 6 ambulance strike teams, which is about 30 ambulances, and had to approve them to go up to Paradise to evacuate Adventist Feather River Hospital, which was destroyed, and a number of skilled nursing facilities, all of which were destroyed. So if you live in a surrounding area, you can expect that. That can have implications for your community. Traffic will be worse than you have ever imagined. Places that should take 10 to 15 minutes. And again, I'm not talking about directly in the evacuation area. I'm talking outside areas. It can take hours to get somewhere that it took 10 or 15 minutes to get to. Additionally, the smoke we've already talked about, so I'm going to talk about it a little bit later about the severity of the smoke in the short term. So I'm going to move now to sheltering, and first sheltering of people. Immediately we had thousands of people in, Dr. Backer I think said 10, we actually had 12 shelters that stood up immediately. Those go in churches. Some of those churches are housing homeless people, and that can displace them. Again, we had about 50,000 people evacuated. Almost all of them came to Chico. Thousands in shelters, tens of thousands with friends, and thousands in parking lots. And you may have seen that on the news. Other things that can happen, Adventist Feather River, all of their patients went to a larger medical center in Chico. So that facility was immediately full and really beyond capacity. Also, that hospital tried to help with refilling medications, but your pharmacies will be immediately overwhelmed for trying to refill medications, especially if it's a fast-moving disaster with evacuations like we had in the Oroville spillway, where it went from 0 to 100, and 188,000 people were evacuated. In this case, 50,000. Many people don't make it home. They don't get their medications. They often don't know what their medications are. And so the pharmacies will be overwhelmed, as will your ERs, as people go there to try to get refills on their medications. Oxygen companies, because people often will not take their oxygen, oxygen becomes a big problem very, very quickly. I would suggest the biggest urgent problem you have in shelters is oxygen. People's concentrators get left at home. They run out of battery power. Food service, gas station, banks are all affected. You've got tens of thousands of people moving through your community. They often didn't bring money. They don't have food. They don't have enough gas. Something that others have alluded to but people forget about is people will not evacuate without their animals, or they will evacuate and leave their animals. So in this event, very quickly, we were sheltering 10,000 animals. That's 4,000 in actual shelters and 6,000 being sheltered in place, animals that survived and lived in the burn region. So at the peak, there were about 600 volunteers a day needed to support that effort. There was about 20 tons of animal food a day that was delivered to those animals. And all that effort was managed by an animal control department that's in the public health department that's 10 people. They sheltered animals for 77 days. Of course, we sheltered humans for longer than that. So other immediate impacts that I'll move through quickly. Smoke, we had PM 2.5 readings in the Chico area of 400 or above for many days. Between Chico and Paradise, there were readings as high as 1,800, and they were above 1,000 for 4 consecutive days. Yeah, I guess you have to be an air quality person to know or care about those numbers, but that's bad. You know, a traffic survey that was done shortly after the population moved in and showed an increase of about 25% in the Chico area all told, and in some main corridors, a traffic increase of 77%. And that continues to this day. So 7 months later, those traffic volumes are up dramatically. Hotels and tourism, the hotels were full and tourists didn't come. So not only do you have the people that are in the evacuation areas, you have sometimes 10,000 workers coming in to volunteer and to help, and trying to find a place for them all to stay is difficult. There was an increase of 1 million gallons of sewage a day immediately, from one day to the next day. That's 15 years of projected growth that happened overnight. We think that, or I fool myself to think that your evacuation happens and you're done with that. But this fire, as many fires, burned for days. And so some of our other populations, Oroville, for 4 days was under an evacuation warning. And so that's where our office is. And at any point, that could have happened, and you know, the disaster goes on to its next chapter, as you've heard, with debris flow. Okay, so now moving to short-term implications, and I'm going to touch briefly on housing because housing has been well covered. We had an increase in the Chico area of about 19 to 20,000 people. That again is about 15 years worth of growth that happened immediately. And that's short term, that's not the immediate. Some of those people have gone on. But right now there are about 20,000 extra people in a town of 93,000. As you've heard, what happens in that case is supply and demand. A lot of the renters can sell their house for a lot more. In 1 year, the property values went up 14%. Next year, they're anticipated to go up another 10%. So it'll be about a 25% property value increase in 2 years. The California projected rate is 2.2. So about 12 times the rate of California in general. And that leads to all the things that you've heard. Thanks. So now medical, and this is what I've spent most of my time with, we lost about 24% of our skilled nursing facility beds for the whole county. We lost an acute care hospital with 18% of our acute care beds. The infant delivery rate for our larger hospital in Chico went up by 44%. The ER visits went up by 40%. So they had a need for increased staffing. At the same time, they didn't have skilled nursing facility beds to discharge their patients. And 20% of the staff in Chico lived in Paradise and Magalia, so they had staffing issues. Crime and safety, if you take the 4 months from the fire until March and you compare it to the year before, traffic accidents up by 23%, traffic citations up by 66%. Violent crime statistics were stable, good news, surprising. Robbery up by 28%, property crimes showed a decrease. We lost 14 schools with 4,500 students. We stood up schools in warehouses at the Chico Airport for the high school, in a OSH building that had been closed down for the junior high school, and the elementary schools were spread throughout other communities. The small town of Durham, where I live, the elementary school more than doubled in size. So now long-term impacts, and this will be brief, because we've already talked about housing, but it doesn't get better anytime soon. It's not something we can change quickly. We already had a problem. We have a bigger problem. Workforce, my wife works for the university. They're trying to bring in professors. They say, I'd love to take that job, but I can't find a house. Medical infrastructure, I mean, I think you understand. I already went through all those numbers about what we've lost and what we need, and we, like many, had a shortage of family practice doctors. Feather River Hospital, Adventist Feather River, all of their specialty care doctors have left the area. They all got jobs elsewhere. Now that population is still there, or at least some of them. We didn't get to keep any of those specialty docs, any of the inpatient docs. There's a California law that says when a community is damaged by a disaster, that the tax losses from that are not just their own, they are shared in the county. So every jurisdiction in our county takes a hit for the loss of the tax base. And also, if you are a surrounding community, you do not qualify for FEMA reimbursement like you do if you're, a homeowner in the town of Paradise. Water quality, again, since I'm not talking about the burn scar, I'm talking about surrounding. We could talk, and you will get a talk about water quality. I'm talking about downstream surface water with contamination of heavy metals and asbestos. Debris in trees, we have 600,000 trees that are estimated to need to be removed. Since I'm not talking about the burn area, I'm talking about trucks. And I mean thousands of dump trucks. News yesterday, dump truck turnover caused an accident in the area. Even if you go out of Roseville towards Lincoln, you will see D-Rock trucks that are bringing debris as far as this and further. And I don't have the time to talk about community trauma. I'm actually, this is the first presentation that I've given on any of this subject, and that's done purposefully because it's activating and it's emotional. And this is not even on the most emotional part, so I appreciate being able to talk on this subject rather than the evacuation itself. One opportunity that affords us, I guess the silver lining, if there is one, is when you lose an entire community, you can say, how would we like our community look in the future? So BG&E just recently came out and said in the town of Paradise, all the power lines will be underground. The town of Paradise has said, and done work on this in the past. Paradise actually was a very practiced and fire smart community, and still this happened. So there are discussions about the 30 mobile home parks that were lost, low-income people losing their housing, about creating green belts as fire breaks, talking about additional evacuation routes. So these are some of the things, changing in the water infrastructure, so if there's a fire, you don't have meters that melt. All those things are available to us if we take advantage of them. Those are the end of my comments. Thank you.